If you are a man over 60 or care for someone who is, you probably know the challenge of getting a good night's sleep. Night after night, you wake up again and again, often because you need to urinate. Many people accept this as a fact of life after 60, but the truth is, much of this trouble comes from habits we can change. Tonight, as your physician friend, I want to share insights that could transform your nights. Let's talk about water. In America, we're told to stay hydrated at all times. We carry water bottles, refill them, and even remind each other to drink up. Hydration is important. But as we get older, when we drink matters just as much as how much we drink. Here is what happens in your body each night. As you settle down, your kidneys slow their work. Your body switches into repair mode, so your bladder and kidneys need a restful, low-pressure environment. When you drink large amounts of water late in the evening, you interrupt this process. The bladder fills up quickly, and for men with an enlarged prostate, called benign prostatic hyperplasia, or BPH, this causes even more problems. The enlarged prostate squeezes the urethra, making it harder to fully empty the bladder. When you go to the bathroom, you might feel like you never finish. Then you lie back down, and the cycle repeats sometimes all night long. This isn't just about lost sleep. Each time your bladder is overstretched, it puts pressure on the delicate prostate tissue. Over time, this pressure can worsen inflammation, make the prostate larger, and make symptoms more severe. In the daytime, you might find yourself needing to urinate more often, with a weaker stream, and with that nagging feeling that something is left behind. Let me tell you about Robert, a retired history teacher from Ohio. He was careful about his health, and he believed that drinking lots of water in the evening helped him flush out toxins. Every night, he finished a large bottle of water as he watched the evening news. But for years, Robert never slept more than 2 hours at a stretch. He felt exhausted and frustrated. When I met him, I explained the idea of hydration timing. We didn't change how much he drank, only when he drank it. Robert started drinking most of his water before 3 in the afternoon, had another glass with dinner, and after 7 p.m., he only took small sips if he was thirsty. The very first night, he woke up only twice. By the end of the week, Robert slept through the night for the first time in more than a decade. His relief was overwhelming. He told me, "I thought my body was failing me. It turns out I was just giving it the wrong instructions." What can you do? Make it your goal to drink 70 to 80% of your daily water before late afternoon. Keep a water bottle at your desk or in the kitchen as a reminder to sip throughout the day. If your mouth feels dry at night, use a humidifier in your bedroom, or rinse your mouth and spit out the water instead of swallowing it. Your prostate is not asking you to stop drinking water. It is simply asking for a break from midnight pressure. This small shift can help you reclaim your nights. In our busy American lives, with habits built around comfort and routine, it's easy to overlook how timing affects our bodies. But by changing when you hydrate, you give your body a chance to rest, restore, and repair. Restful sleep is possible at any age. Give your prostate the quiet night it needs, and you may be surprised by the difference in how you feel every day. Many people find comfort in dinner time. After a long day, dinner can be a moment to relax, to reward yourself, or even just a practical way to fill your stomach. But what many Americans do not realize is that the foods chosen for dinner, especially salty and processed options, can quietly set the stage for a restless night and aggravate prostate problems. Let's think about sodium, or salt, which is present in high amounts in most American diets. The Centers for Disease Control and Prevention estimates that over 90% of adults in the United States eat more sodium than they should each day. But how does salt affect your night? Salt acts as a magnet for water, pulling and holding fluid in the tissues of your body. When you enjoy a salty dinner, maybe canned soup, frozen pizza, deli sandwiches, or chips, you may feel bloated, your fingers may swell, and your body has to work hard all night to move this extra fluid out. For men over 60 with an enlarged prostate, the consequences of a salty dinner are even more serious at night. During the day, gravity pulls excess fluid into your legs and feet, but when you lie down to sleep, that fluid redistributes, and your kidneys suddenly have to get rid of the extra salt and water. This leads to more urine being produced during the night, forcing you to wake up several times to go to the bathroom. Salt doesn't just make you wake up more. High sodium in your diet keeps your circulatory system on high alert. Your kidneys work overtime, your blood pressure goes up, and the tissues around your prostate can become more inflamed and congested. If you already have an enlarged prostate, this is a perfect storm for discomfort and interrupted sleep. Let me share the story of Harold, a 78-year-old retired veteran from Michigan. After his wife passed away, he started relying on microwave dinners, salty snacks, and canned chili. Harold thought he was doing well because he avoided drinking water late at night, but he was still getting up 4 or 5 times every night to urinate. When we looked closely, the culprit was his salt intake. Together, we made small changes. Harold switched his dinners from processed foods to simple, fresh meals like grilled salmon, roasted vegetables, and brown rice. He replaced salty crackers with unsalted nuts or air-popped popcorn. He also started making a large pot of homemade vegetable soup with herbs and just a little salt for the whole week. After only 2 weeks, Harold was sleeping almost through the night. I said, "I had no idea salt was ruining my sleep. I thought it only affected my heart." The science supports these stories. Too much sodium is linked not just to high blood pressure, but also to chronic inflammation, including in the prostate. When the prostate is inflamed, it is more sensitive, it swells more easily, and you feel greater urgency and discomfort. What can you do to protect your sleep and your prostate? Focus your evening meals on fresh, unprocessed foods. Choose lean proteins such as fish, chicken, or beans. Add plenty of vegetables and whole grains like brown rice or quinoa. Use herbs and spices such as garlic, oregano, basil, or a squeeze of lemon instead of reaching for the salt shaker. Always check labels on any canned or ready-to-eat foods, because sodium can be hidden where you least expect it. Try to prepare meals in advance when you can, so you're not tempted by the convenience of salty options. Changing what you eat at dinner might feel challenging, especially if you are cooking just for yourself. But even small shifts can lead to much better nights. Remember, you are not just eating for flavor. You are eating for comfort, for better sleep, and for a healthier prostate. Your body and your nights will thank you for every positive change you make. One of the most overlooked but harmful habits among older men is resisting the urge to urinate during the night. It may seem harmless to stay in bed, hoping the feeling will pass or waiting until morning, but this choice can actually worsen prostate and bladder health over time. As a doctor, I have seen many men in America suffer needlessly from this simple mistake, and it is often tied to pride, routine, or fear of admitting their body is changing. Imagine it is 2 o'clock in the morning. You are comfortable, wrapped up in your blankets, and the room is silent. Suddenly, you feel a mild pressure in your lower abdomen, a clear signal from your body that you need to urinate. The debate in your mind starts. Do I really need to get up? Can I just ignore it and sleep a little longer? Maybe I can hold it until morning. This is a story I have heard from thousands of patients, from Boston to Los Angeles. Many of them believed that getting up at night was a weakness or simply part of growing old, so they tried to fight the urge and stay in bed. But the reality is that ignoring your body's signal is more dangerous than it seems. The bladder is not a bottomless bag. It is a muscular organ designed to stretch, but only up to a point. If you keep holding urine night after night, the bladder wall slowly loses its flexibility and strength. This can lead to incomplete emptying, and some urine always remains in the bladder, which becomes a perfect place for bacteria to grow. The risk of infections rises, and the discomfort of urgency and incomplete voiding becomes your new normal. For men with an enlarged prostate, the risks are even greater. The extra pressure from an overfilled bladder is forced downward onto the already sensitive and swollen prostate tissue, making inflammation and irritation worse. Over time, this constant cycle of holding in urine can cause more frequent infections, more difficult urination in the mornings, and a weaker urinary stream. I remember talking to Arthur, an 81-year-old retired Marine from North Carolina. He was disciplined and prided himself on not giving in to nighttime urges. For years, he told himself that it was just mental and he should stay in bed. But as the years passed, Arthur began to struggle with repeated urinary tract infections, a constant tightness in his lower belly, and mornings that started with a slow, weak stream. After discussing these issues together, I encouraged him to respect his body's signals and get up the moment he felt the urge, no matter how minor it seemed. Within a month, Arthur noticed dramatic improvement. The morning tightness faded, his infections stopped, and his energy returned. He told me, "I wish I'd started listening to my body sooner." What should you do if you want to protect your prostate and sleep better? First, make your path to the bathroom as easy as possible. Keep a nightlight on, put a robe and slippers next to the bed, and clear any obstacles so you don't have to hesitate. Second, don't bargain with yourself when you feel the urge. Just get up and take care of your body. Remember, this is not a weakness. It is a wise and proactive way to protect your health. If mobility is a challenge, consider a bedside urinal or ask your healthcare provider about helpful aids. By simply responding to your body's cues, you reduce pressure, inflammation, and the risk of infection. Many of my patients are surprised at how much better they feel in the morning when they make this small change. Emptying your bladder during the night is not just about comfort. It is about keeping your prostate healthy, your bladder strong, and your mornings more peaceful. This is a simple act of respect for your body that can bring real benefits night after night. Most men rarely think about how their sleeping position affects their health, especially when it comes to prostate problems. Many simply fall asleep in whatever position feels comfortable and never give it a second thought. But as a physician, I have seen how something as simple as your sleeping posture can make a real difference, especially for men over 60 who struggle with frequent urination at night. Scientific studies now show that sleeping on your stomach can silently make things worse for your prostate. When you lie face down, the full weight of your upper body and internal organs presses directly onto your lower abdomen. This means gentle but persistent pressure on the bladder and the prostate gland beneath it for hours every night. You might not feel pain at the time, but over years, this steady pressure can slow down blood flow, reduce drainage of fluids, and cause congestion in the pelvic area. All these effects make inflammation worse, contribute to swelling, and may even cause the weak urine flow and urgency you feel in the morning. Let me share the story of Tom, a 74-year-old retired mechanic from Illinois. Tom had slept on his stomach since he was a boy, believing it helped with his back pain. For years, he woke every morning with a dull ache in his lower belly and always needed to rush to the bathroom. No specialist could find the reason, but after a detailed conversation about his sleep habits, we realized the root of his problem. Tom was hesitant, but he agreed to try sleeping on his side for 2 weeks. He built a pillow fortress around himself, a firm pillow between his knees to keep his hips and spine aligned, one to hug for his arms, and another behind his back to stop himself from rolling over. Within a few days, his morning ache faded. After several weeks, he slept better and woke up less often during the night. Tom said, "I never knew something so small could have such a big impact." Sleeping on your side, especially on the left, helps blood flow and reduces pressure on your bladder and prostate. If you prefer sleeping on your back, placing a small pillow under your knees can help keep your spine in the right position and take pressure off the pelvis. Changing a lifelong habit is never easy, but small adjustments can add up to big benefits. If you have difficulty changing positions, try using body pillows or rolled towels to support your sides and prevent rolling onto your stomach during sleep. A firmer mattress can also make it harder to sink down and end up sleeping face down. Here in the United States, our soft beds and heavy blankets often encourage sleeping in unhealthy positions. Combined with sedentary lifestyles and weight gain, it's no wonder that pelvic congestion and prostate problems are so common among older men. By simply paying attention to your sleeping posture, you can reduce pressure, improve circulation, and help your prostate recover night after night. This gentle change could make your sleep a time of real healing and bring more comfort to every morning. Many men overlook the importance of one simple nighttime habit, making a final trip to the bathroom just before bed. This small action can have a significant impact on prostate comfort and sleep quality, especially for older men in America. Often, after brushing their teeth and turning out the lights, men feel only a slight urge to urinate and decide to ignore it, believing it can wait until morning. But going to sleep with even a partially full bladder means that urine sits in the bladder for hours. This puts gentle but steady pressure on the bladder wall and the prostate all night long, leading to irritation and an increased risk of inflammation or infection. Let me tell you about Michael, a 69-year-old from Colorado, who avoided that last bathroom trip out of habit. He never felt a strong urge, so he simply went to bed. Over time, he found himself waking more often at night and struggling to get going in the morning. After talking together, I recommended making the last bathroom visit a non-negotiable part of his bedtime routine, as automatic as setting his alarm. I also taught him the technique of double voiding. He would urinate as usual, then pause, relax, lean forward, and try to go again. Often, a little more urine would come out, and Michael was surprised at how much better he slept. Soon, his nights became more peaceful and his mornings started with less tension. This final trip to the bathroom is about more than just relieving a mild urge. It signals to your body that the day is done and that it is time to rest and repair. Emptying your bladder fully before sleep gives your prostate and bladder a break from constant pressure, creating the best possible environment for healing. If you skip this simple habit, you may find yourself struggling with interrupted sleep, more urgency in the morning, or a sense of heaviness that carries into the day. To help yourself, make visiting the bathroom before bed a ritual. After washing your face and brushing your teeth, sit down and take a moment to fully empty your bladder. Don't rush. If you want to try double voiding, finish urinating, take a few deep breaths, and then gently try again. You may be surprised at how much more comfortable you feel. Men sometimes accept frequent nighttime urination as a natural part of aging, but the truth is that simple habits have a powerful effect. By including a final bathroom visit in your nightly routine, you allow your body the chance to rest, reduce irritation, and wake up with more energy and less discomfort. Every night you choose this small act of care, you are investing in a healthier, more restful future. In summary, small changes in your nighttime habits can make a powerful difference for your prostate health and your quality of sleep. By paying attention to when you hydrate, choosing lighter and less salty dinners, listening to your body's signals, adjusting your sleeping position, and always emptying your bladder before bed, you can enjoy more peaceful nights and start each day with more comfort and energy. The benefits are real: less nighttime discomfort, fewer interruptions, and a better sense of well-being every morning. I encourage you to apply these simple tips in your daily life. Share what you've learned with friends and family who may benefit. And if you found this information helpful, don't forget to subscribe to the channel for more valuable health insights. Leave a comment below about your experiences or topics you'd like to learn more about. Thank you for listening and taking a step toward better health. Wishing you restful nights and strong, healthy days ahead. See you in the next episode.